Melanoma is the most serious and life-threatening type of skin cancer. It almost always is treatable when caught early, but if it metastasizes or spreads to other parts of the body, it becomes difficult to treat. And joining us with more information is Dr. Adil Daud, co-director of Melanoma Clinical Research, and his patient, Colleen. Thanks to both of you for being with me.
Thanks for having us.
Thank you.
Of course. Doctor, let's start with some important stats that people really need to know about the prevalence of this disease.
Yeah, so skin cancer, it's the most common cancer in the United States. Most of them are basal and squamous cell cancers, which are basically local and are extremely curable, do not tend to spread. Melanoma, which is not as common, about 100,000 cases in a year, is more likely to spread. About 7,000 metastatic melanomas in the United States. So 7,000 that where the cancer spread beyond its original site.
Got it. Now, is there a genetic role, people might be wondering, in getting melanoma?
Yes, there's an important genetic contribution to it. Fair skin is an important predictor, and then about 10% of melanoma patients have a familial history. So and Colleen has a familial history, and she can talk more about this, but where you can have multiple people affected with melanoma in your family.
Okay, and Colleen, how did you know first that something wasn't right? Tell us your story.
Sure. So 7 years ago, I noticed an unusual mole on my calf, and I got into the dermatologist immediately. Even though I had seen her 9 months prior, I knew something wasn't quite right. Sure enough, she confirmed my instincts on that, and it was a melanoma. It was stage 1B. However, a year later, after going in every 3 months, the cancer had spread to my lymph node and also my liver. And at that time, it was stage 4. So I went ahead and did the BRAF mutation testing and was tested positive for that. And through several channels, I was able to meet up with Dr. Daud in UCSF, and a treatment had come out just 1 month prior and was approved by the FDA for Mekinist and Tafinlar. And got on that medication immediately. 2 months later, my scans were clear. I was very hopeful at that point, and that's not everybody's typical story.
Mm-hmm.
However, it's just great news with this study from the New England Journal of Medicine.
Mm-hmm. And we have to get educated, so what's the website to get more info?
Cancer.gov, that's the website that we go to. That's reliable information. For these specific drugs, us.tafinlarmekinist.com is a good website too.
All right. Thanks to both of you so much for your time.
Thank you.
Thank you.
Stay where you are. We'll be right back.